I think domestic violence is a tradition everywhere in the world. Even research in Western countries shows the rates of domestic violence haven't come down. The reason why women don't break the silence in India is because there's nothing they can get after they break the silence.
We were really trained not to write anything. We are the doctors. Our job is to treat the patient and let them go back. We are not going to talk to them for anything else. It's police job. It's not our job.
Police alone cannot do anything. We require the help of NGOs, and after all, offences against women is a sort of social offence. And for this, we just cannot go and knock at a house and bring the husband to the police station and lock up the mother-in-law. This will break down her family support system.
What I feel is hospital is the right place, because when a woman gets beaten up, it is not the police she will first run to, but what she needs maximum at that time is that her injuries are attended to, whether they are physical or mental. You cannot solve these problems, say, overnight, but at least a process has to begin.
A lot of my work in the Ford Foundation, looking at the field of reproductive and sexual health, I began to see that a lot of issues of reproductive and sexual health are very intertwined with gender violence. Traditionally, violence hasn't been seen as a health issue, definitely not as a reproductive health issue. So we decided to have a regional meeting, the 5 program officers in the 5 countries. It was Vietnam and Thailand, Indonesia, Philippines, China and India. And in each of our countries, we decided to bring 2 grantees from the reproductive health field and 2 grantees from the human rights field, so that we could actually have a discussion that would interlink both these fields. We also then decided to invite some external resource people. And in fact, it was my colleague who had been to a meeting about the police in Bangladesh and had heard Dr. Hassan from Malaysia. Some of the other program officers also had heard of him and had heard of his work and were very excited. We had this meeting in 1998 where Dr. Hassan presented his work with the crisis center in Malaysia. He was seeing a lot of women that were coming into the hospital that were battered and abused, and their needs were not being addressed. So he developed this concept of the one-stop crisis center where women could come into one space in a hospital and their legal needs, their counseling needs, their health needs could be addressed. The center could be connected with the shelters in that city. After a couple of years, it became mandatory by law for all hospitals in Malaysia to have a crisis center. It was that piece that sounded really exciting. At the meeting itself, one of my grantees, Sehat, and the participant from that organization, Dr. Amar Jasani, and I had a very, very casual 1-minute conversation saying, wouldn't it be great if we had one-stop crisis centers in India? A few months later, he had actually done a lot of research on what had the Philippines done on this issue. And he came back and he said that I'm willing to explore the idea of doing something like this with the Bombay Municipal Corporation that has already been working with another NGO to make their health care services more women-centered. We really felt that to address issues of scale, that it was not okay for just Sehat to go and begin a one-stop crisis center in a hospital. You couldn't set up a one-stop crisis center in an NGO that would only serve a few people. I mean, and I think the analogy I draw is this whole idea of when we fund NGOs alone, we create these wonderful islands of excellence, but they're still islands, and you have to walk through water to get from one to the other. And we need to we need to kind of bring these together to create a bigger mass and to create more impact. We knew that we had to work with the public health system to achieve greater impact.
Government-NGO relationship has always been very contradictory in India. We as an NGO can never replace the need for the government intervention in the healthcare for the needy people. And Malaysian experience as well as Filipino experience told us that yes, it is possible to motivate them, to link up with them. And the strategy is to find right kind of people in those structures who are interested in the similar kind of thing. We haven't looked for them, so why don't we go and look for them?
We both made a commitment to talk anytime we got a chance about what we had heard about the Philippines experience, the Malaysian experience. Amar really did a lot of the legwork, at least getting the curiosity of the BMC officials.
The final signature to dispatch, then things are fine.
I had a very wrong impression in the beginning. I said NGOs only talk, they don't do anything. There's no action. Anyway, I said, oh, no, okay, if you can do anything, you show me, you bring your project.
And then they told us what is done in places like Malaysia and Manila. And they said, would your officers and you like to see that, and can we do something like this in the city of Mumbai? And I immediately agreed.
If it's happened in some other country, why hasn't it happened here? We were hoping to capitalize on that. And so the idea of the study tour came fairly early on. You really learn so much more from actually seeing what's happened. We thought of going only to Malaysia and only to Dr. Hassan's office. Amar came back to me and said, if we're going all the way to Malaysia, why can't we also go to the Philippines? And it made sense, because we would also then see a comparative model of crisis centers. So we wanted to take Dr. Alka Karande, and we very quickly decided that we should definitely take the head of the hospital, where we would want to begin the one-stop crisis center. It was a huge process just for the BMC officials to get permission to travel to the Philippines and Malaysia. It took us 9 months. The government does not easily allow officials to travel outside the country. Till the night before we left, we did not have permission for Alka to travel. And we kept delaying the trip day by day by day. And we had a deadline of Monday evening. And it was Monday, I think, at 6 o'clock in the evening when she got permission, and we all flew out at 10 o'clock that night.